All right, can we see me now? The quality, the video might be like 1 second delayed, but this is my other option. So hopefully this camera works for us. I don't know why my main one isn't working, but let's go ahead. Let's get started. If the video is lagging too much, I can try some other things. So just let me know if it's not working quite right. Just let me know in the comments and I'll be paying attention to those. But my name is Rachel Taylor. I am the Director of Nursing here at Archer Review, and I am super excited to hang out with you guys over the next 30 minutes. We are going to be doing rapid fire questions. So if you like to do practice questions, we're going to be doing a lot of them today. We're going to talk about tips and tricks to answer those NCLEX style questions as well. So let's get started with our first question. You're the nurse performing education for a client with AIDS at the community clinic. Which of the following statements is an example of appropriate teaching? Okay, pause here. Let's look at these. When you get a test question, what I want you to do is I want you to look at them one at a time. So A, do not wash your dishes with your roommate's dishes. Is that appropriate teaching? Are we worried about someone washing dishes together with other dishes? What do we think? Just give me a yes, a no. Okay. I agree, right? I'm going to say that's not appropriate teaching. A's out. Let's look at B. Clean all utensils and dishes before reusing them. What do we think about B? Is this appropriate teaching? Okay, guys, I gotta just ask. Are we using dirty utensils anyway? Probably not, right? Like we should always wash them. And why are we thinking about that? Well, stagnant water, food particles, do you know what that causes? It causes microorganisms to grow. And somebody with AIDS is very susceptible to infection. So because they're susceptible to infection, oof, I don't want them getting anything where microorganisms are growing. I like answer B. We're keeping it on the table. C, do not use the same shower or toilet as your roommate. Okay, are they going to spread AIDS through using the same shower? No, that's not how AIDS is going to be spread, right? So we're going to say that's incorrect teaching. And then lastly, D, hand sanitizer is not necessary unless you plan on touching someone else. Do we wash our hands even if we're not touching somebody else? We totally wash our hands, right? Like we are going to wash our hands frequently throughout the day, especially for somebody who has a risk for an opportunistic infection. I think of my grandma, guys. She had leukemia, and we literally wouldn't even have her touch a door into a public restroom. We would sanitize everything before she would touch it. And the reason why was because if she got an infection, it would kill her. It would have been fatal to her. And so really thinking about keeping hands clean is super important for preventing that infection. So our answer here was answer B. Amazing job to those of you that got it right. And I'm going to do something fun and it's going to make me laugh. But you got it. Woo! The little things in our presentation, there's like confetti, there's a drum roll. I find all of that very fun. So we're going to try it today. All right, question 2. The nurse is inserting a nasogastric tube. The nurse is correct in performing which of the following sequential actions? Place each action in the correct order. Okay, I'm going to give you guys a moment to do this, and then we're going to walk through it together. I'm seeing mixed answers here. Okay. Amazing, amazing. All right, I'm going to give you guys a tip. When you get put in order questions, this is a great time to utilize your whiteboard. So what I like to do is I like to get out my whiteboard. I'm going to get a marker out here. And what I like to do is I like to just take that first one and I just pull it over. So what I think of is A, place the client in a high Fowler's position. Well, I don't know exactly where that's going to fall, so I'm just going to kind of put it in the middle, right? So I've used A. Let me get a thinner marker. That one's really thick. There we go. So we've used A. B, confirm placement. Well, we know that B is going to be toward the end because if we're putting in an NG tube, we're confirming placement pretty much last, right? Before we actually start the suction. So we've used A, we've used B. C, insert the tube into the nasopharynx and advance the tube. Well, I'm not inserting the tube until I've put them in high Fowler's, but I'm doing that before I confirm placement. So I'm going to put C kind of in the middle. Something else might go around it. I'm not sure yet, but I know that it falls in between A and B. Now D, secure the tube to the client's nose and gown. When do we do that, guys? We do that toward the end of the procedure. So we're going to put that right before we confirm that placement. And then E, instruct the client to swallow sips of water. Well, we would have to do that after we've started inserting the tube, right? Like the tube has to be in the nose before we're telling them, hey, try to swallow, because that's what's going to advance that tube. So we know that that's going to come after C. And then F, measure the length of the tube from the nose to the earlobe to the xiphoid process. We can remember NEX. It's a great memory trick. NEX for how long we want that tube to be when we're inserting it. And we're going to do that after we've put them in high Fowler's, but before we start inserting the tube. Now, once I write my order on my whiteboard, I double check to confirm, does it make sense in the order I've placed it in? So am I first going to put the client in high Fowler's? Yep, that makes sense. I then am going to measure the tube using the NEX acronym. After that, I'm going to insert the tube into the nasopharynx and advance it. And then I'm going to have them swallow because that's what's going to advance that tube into the stomach. After I've done that, I'm going to go ahead and secure it to the nose and gown, and then I confirm placement. What is the only way we are going to confirm placement? What is the only way that we are going to confirm placement? Yes, very good. Absolutely. We have to have an x-ray. That is the gold standard. Very good. Nice job on this one. Here's that order one more time in case you didn't get it written down. Anyone use that strategy for put in order questions? It's one I have used for years. I absolutely love it. I think it is super helpful. Congrats to those. I've got a couple people on Instagram and TikTok letting us know they passed using Archer Review. Incredible. Amazing. All right, rapid fire. Here's our next question. The nurse is visiting a client who is 82 years old, has impaired vision, and lives alone. It would be necessary for the nurse to follow up if the client states which of the following. Select all that apply. Who likes select all that applies? Let's raise your hand if you don't love select all that applies. Anyone feel like, ooh, SATA questions, not my favorite? I've got some tips up my sleeve to make these a little bit easier. My best advice, though, when it comes to a select all that apply question is to choose what you are confident in. Don't just add extra answers to add them. Choose what you feel confident in. Amazing. You guys are doing really, really well. Seeing lots of right answers here. I'm going to give you guys another 30 seconds. Do I have anybody here who is still in nursing school? Anyone here still in nursing school? Okay, looks like we have several that are still in nursing school. Amazing. if that is you, you should definitely check out our nursing school product. We have a full product that kind of is a companion to your nursing school that you go through, and it is incredible. We've got many lectures throughout it that really are going to help you break down those hard concepts in nursing school. We've got testing tips, we've got how to study in nursing school. So if you need some extra help or even just how to break down questions like I'm doing today, all of that is in our nursing school product for those of you still in school. All right, let's walk through this question together. So when I get a select all that apply question, I'm going to utilize the 3 steps to a select all that apply. So our first step is just to reword this question in our own words. So what I would say is, client care for an elderly, or living home conditions for the elderly, things like that, or for a fall risk. Really, that's my concern, is there's a potential fall risk here. What do I need to do to make sure that this individual stays safe? So this question makes me think of a neighbor I had growing up. She was about this age when I was growing up. She lived across the street from me, and I used to go to her house all the time. I loved to go visit with her. But do you know what she had all over her house? She had a bunch of throw rugs, okay? Well, what's our concern with these throw rugs? With throw rugs, there's a fall risk, right? Because you can get caught up on them. And I distinctly remember when I was young, she tripped on one when I was there. And I was like, "Oh, are you okay?" She's like, "It's okay. I'm just going to use some tape to make sure that it stays down." And so is that appropriate? No, we want to advocate for no throw rugs. If we want to, have them use a throw rug, I prefer them have a big area rug instead of a little throw rug, because there's less of a tripping hazard. And she had them all over her house. So we're going to say, hey, we need to follow up for A, because our second step to a SATA question is, are we looking for true answers or false answers? And when we see the word follow up, what does that indicate? Are we looking for true answers here, or are we looking for those false answers? Now, somebody asked, hey, is it okay if I share this live on my socials? Absolutely. Feel free to share the live, tag other nursing students that you know, or those prepping for their NCLEX. We want anyone who wants to see these for free, get to see them. Good, we're looking for false answers. Anyone ever skip step 2 and then accidentally answer a question as if it were true instead of as if you were looking for false here? Anyone ever do that? I know I have done it. I'm guilty of it, right? So I always recommend do step 2 every single question that you get on your exam, because it's really easy to skip that step. The third step, we just go through them one at a time. So now let's look at B. I switched to using an electric shaver instead of a razor. Do we prefer an electric shaver? Is that good? The first step, Jasmine, reword the question in your own words, short, sweet, and to the point. Yes, we like an electric shaver. There's less risk of getting a cut, so we're good on B. C, I usually sit in a recliner while I listen to the television. Are we okay with their feet being up while they're watching TV? Is that good? Or are we concerned about that? This is good. I like this. Why? What do they struggle with? We want to get that blood flow back up to the heart. So how do we get the blood flow back up to the heart? We have them put their feet up. D, I use different shaped containers with lids to organize my meds. Is this helpful? Different shaped containers. Absolutely, guys. Med management is huge. When I think of geriatric patients that I've taken care of, I think of one of the big reasons that allowed them to stay more independent and stay in their own home was that they were able to manage their medications. I've seen tons of different methods for med management. One I really like is it's one that will pop open the pills based off of time. So someone loads the medications in, and then when the time hits that it's time for them to take it, it'll just open so that they know, okay, these are the meds that I need right now. But another way to do it is just have different shaped containers. So if your morning ones go in this container, afternoon in one container, and then evening in another, it makes it a lot easier to manage those medications. We want to help our clients stay as independent as they want to be. And this is a great way to help them with that med management. Now, E, I use the upstairs bathroom instead of the one downstairs. Do we want somebody going up and downstairs every time they need to go to the bathroom? No. And think about it too. Like I think of my grandma here. When she needs to go to the bathroom, she can't wait like 10 minutes. She's got to go to the bathroom, right? And so if she really has to go and she is walking, up or down the stairs, let's think about it. And she's like, oh, I really got to go pee. She's at a high fall risk because she's going to be hurrying to try to make it to the bathroom on time. Very good job on that question. A and E were correct. Let's do our drum roll on this one. A and E were right. You guys did awesome. Okay, let's go ahead. Let's do question 4. You're working in the emergency department. We've got a 23-year-old woman comes in after being bitten by multiple fire ants. Those darn fire ants, right? You examine her. You notice that there are many fluid-filled bites on her legs, her ankles. She's got numbness in her face. Her lips are swelling. She has shortness of breath. Her respiratory rate is 28. You hear wheezing when you auscultate her lungs. Her heart rate is 110 and her blood pressure is 82/40. Okay, I want us to pause for just a moment. Are we worried about the airway here? Are we worried? Is there any indicator that this airway could be at risk here? Give me a yes or a no. And what made you worried? What told you, oh no, I'm a bit concerned about the airway? What made me concerned about the airway is there is swelling around the lips. We are seeing that there's a good chance that there could be some angioedema going on. Now, what tells me here that there are breathing concerns? What tells me that there might be some breathing concerns? So what tells me breathing is that the respiratory rate is elevated at 28 breaths per minute. There's shortness of breath, okay? Those are big indicators that breathing is compromised. Now, what tells me that circulation is compromised? Now, the big things that are telling me circulation is a heart rate of 110, a blood pressure of 82/40. So we see airway, breathing, and circulation is of concern. So which of those 3 would I be prioritizing if all 3 are at risk? What's my highest priority here? My highest priority is the airway. So now that we've determined that, what order would you put these in now that we know our highest priority? Utilize that trick that I taught you just a few questions ago. All right, let's do this together. So what I like to do, pull the first one, administer epinephrine, and I'm just going to put it in the middle because I don't know where it goes yet. Ensure a patent airway. Well, what did we say our highest priority was? The airway. The airway is at risk for closing. I need to do that first. So we've used A, we've used B. C, administer an antihistamine. Well, what's going to do more good for my client? Is getting them epi going to do more good for them, or is getting them an antihistamine going to do more good for them? Which is going to help my client survive here? Yeah, I want the epi over an antihistamine. So I'm going to put C over here, and then we just have D left. Place on a cardiac monitor. That's not saving them. That's not doing an intervention that's actually going to save their life. It does help me monitor, but that monitoring intervention is going to go last. D is last. So now let's read it in order and let's make sure it makes sense. So let's start off. We're going to do B first, ensure a patent airway. Absolutely. If the airway closes, my client can't survive. Okay, the second thing we're going to do then is administer epinephrine. What does epinephrine do for us? Anyone remember what epi does? Anyone remember, why would we use epinephrine? What is it going to do for me? How does epi help our client? Why do we use it in a code? What's it going to do? Okay. I'm seeing it's going to increase the heart rate. What else is it going to do? It's going to open that airway. It's going to cause bronchodilation and vasoconstriction. Very good. So what is epi actually going to do? It's going to open up the airways, but it's also going to help increase that blood pressure some because they are very hypotensive. Nice job. Impressive. I don't know who got it right in the chat, but I saw several of you. So very good job on that one. So then once we do that epi, then we're going to consider the antihistamine. And then lastly, and the antihistamine, right? It's just going to calm things down, remove some of that swelling and stuff that's in the way. And then D, then we get them on that cardiac monitor. Very good job on that question. We're going to try another one of these little, woo, that was fun. B, A, C, and D. That is the correct order we would want to do this. Very impressive work. Okay. Real quick, I do want to take a moment to talk about tutoring. And here's why. Our private tutors have been hand selected to help any of you with basically whatever needs that you have. We have nursing school tutors, we have NCLEX tutors, and they can kind of all do everything. But what our tutors do is if you're like, I don't feel ready to test, or I'm not sure if I'm ready to take my NCLEX exam, that's when our private tutors come in. If you're feeling a little overwhelmed, like you maybe have bad test anxiety, or you need some reassurance, you need somebody who's rooting you on and supporting you. Or maybe you're like, Rachel, I hate OB and I don't want to get a single maternity question. Well, then you want to go work with Elizabeth, right? And so if you need further help, that's where our private tutors come in. It is $75 per hour, and it is such an amazing investment. Students leave rave reviews on all of our private tutors, how much they've helped them be successful. So if you're somebody who's maybe struggling a little bit more, maybe you're feeling like, man, I just need a little extra support. That's what our private tutors are for. We're here to help you. If you have questions about private tutoring, or maybe you don't know if private tutoring is a good fit for you, you can always reach us at nclextutors@archerreview.com. You should see that email up on the slide. All right, who's ready for another question? Yeah, if you're debating pushing your test back, that's the appropriate time to meet with a private tutor. Absolutely. If you don't know if you should push it, spend the $75, meet with a private tutor. They will guide you and help you. Okay, we've got more questions. We're not done yet, guys. I'm not done. I still have 6 minutes of your time. I'm going to use all 6 minutes. Okay. All right. So our next question. This one's a little tricky. The nurse is discussing infection control. All right, let's be honest. Who likes infection control? Who doesn't like infection control? It's tricky, right? I remember thinking as a nurse, like, oh my gosh, I'm going to get this all mixed up, right? But you guys have got it. You've got it. So let's walk through it together. The nurse is discussing infection control with a group of nursing students. It would be correct to state that the contact precautions with alcohol-based hand hygiene, hint, hint, should be sufficient for which of the following conditions? Let's talk about it. I'm going to give you guys a minute before we talk about it. I have someone on Instagram saying, hey, I just had a baby. I'm looking forward to taking my NCLEX. Absolutely. Just to give you guys some insight, I've had a lot of students lately who are like, Rachel, I've had this thing happen in my life, and it's pushed me back a little bit in taking my exam, or this big event happened in my life. Like I just got married, I had a baby, or, I moved across the country or to a new country, all of those things. And I just want to say that you are still very, very capable. You've got this. Stay determined, stay consistent, and that's what's going to really help you be successful. All right. Kudos to you guys. Kudos to you guys for keep working at this despite all the curveballs that life can throw. All right, let's talk through this. We are thinking here of which of these are contact precautions. So is RSV contact precautions? Yes or no? Okay, RSV is contact precautions. So then we ask ourselves, this was changed probably in the last 3 years, I believe. I can't remember exactly when they changed it. It used to be droplet. It is contact now. It is contact. RSV is contact. So is alcohol-based hand hygiene sufficient? Yes, it is. So we are saying yes to A. A is correct. B, mumps. B, mumps. What do we think about that one? Well, mumps, what precautions do we need? We need droplet. RSV is contact. RSV is contact precautions. B, mumps is droplet. So we're saying yes to A. We're saying no to B. C, rubella. What type of precautions do I need for rubella? Well, we can remember MMR. So rubella and mumps are both droplets. So we're going to say no to C. Now D, varicella. What type of precautions do I need for varicella? And if you want to be notified when we go live, give us a follow on Instagram, on TikTok. You should get, like, at least I do on my phone, I get a little message whenever we go live. I'm pretty sure there's a way you can have it message you. At least for Instagram, for sure there. Okay, varicella is airborne precautions. So contact isn't going to be good enough. Now, how about scabies? What do we think about scabies? Is scabies contact? Yes, it is. Because if I were to touch it, right, that could cause it to be spread. Now, is alcohol-based hand hygiene okay with scabies? Yes. So we're going to say yes to E. Now let's look at C. diff. Is C. diff a contact precaution type? Or do we need contact precautions, I should say, for C. diff? That's how I should have verbalized that. Yes. But is alcohol-based hand hygiene sufficient? There's really two key things we have to ensure here. Alcohol-based hand hygiene is not sufficient here. And so because of that, we're going to say no to F. Our correct answers here are just going to be A and E. A and E, there's just the two. So how these are scored is you get +1 point for each correct answer you choose, minus a point for each additional. If you missed an answer, it's just like null. It doesn't give you minus a point, but you don't get that point. So that is why my advice on these select all that apply questions is to choose what you are sure of. Okay, we've got time for one more question. We're going to do one more. What would the nurse expect to administer to a client who presents to the emergency department with a toxic acetaminophen level? This one will be really quick. Nice. Very good. It basically looks the same, right? Acetylcysteine. Now, what I will say is acetylcysteine, when I've had to give it, it smells kind of like rotten eggs. I don't have a better way to describe it. And so it smells bad, and that's okay. It's normal. As much as we're like, is this normal or not? It is normal. It's still good. It just has a really bad odor to it. Yeah, it just doesn't smell very good. Now, when would we use these others? When would we use B? Deferoxamine mesylate. When would we use that? What type of intoxication? Iron. This is for iron specifically. Then what about Suxamer? When would we use that? That's going to be for lead. And then what about flumazenil? This is one I need you guys to know. This is one heavily tested on. Benzos. We use that for benzos. Very good job. Now, I just want to leave you guys with this, and then I will show you signups, and I have a code for you all. So if you don't have our product yet and you're like, this was helpful, I want this, hang around. I've got a coupon code for you all. But Archer Review is here for you guys across the lifespan of the nurse. So if you're like, Rachel, I already graduated. I saw lots of you who are like, hey, I already passed, but you're still showing up anyway. We really want to support you as new graduate nurses. That's why we have our pharmacology crash course, because that's something as a new grad that's stressful. We even have nurse practitioner resources. So if you're just debating on like, hey, do I want to go back to school or not? Follow our NP page on Facebook. Engage with them there. They will gladly help guide you and support you. We really want to create a supportive environment so that way you guys feel supported, whether you're day one trying to get into nursing school or you are practicing as a nurse. We are here for you at Archer Review. Those are all the QR codes for our products, but I do want to take a moment to give you a coupon code for those of you who are like, I am really interested in this product. So what you can do, and then also, was this helpful? Was this helpful? I can see your messages. If I didn't answer something, please just go ahead, email us, nclextutors@archerreview.com, or if it's a support question, support@archerreview.com. There's like thousands of you, and I have one chat support. So if we missed a question, email us. But what you can do for the coupon code for NCLEX specifically is you can go to Archer Review and then head on over to nursing. Once you're here, for any of our SurePass combos, you can use the code Archer Cares. It's going to give you 10% off. We don't usually run a whole lot of discount codes, but we've got one going. So if you've been on the fence, now's the time to go ahead and make that purchase. If you're interested in nursing school, what you will do is you would go to nursing, click nursing school, and then you can buy the courses here. Now, this is really cool. So you can buy it where you get a whole bundle of courses. You can go ahead and buy all of the courses. It's $199 right now. Or if you just need a course and you're like, I really want to learn how to break down questions, you can do that with Nursing School 101, and it's only $15. Or let's say you're like, I'm in pharm right now and I am drowning. This is a hard class. For just $15, you can get that whole pharmacology bundle. It has practice questions, it has videos. These videos are mini lectures. And so they are really to the point, there to support you and help you in the things that we most likely expect you to see through nursing school. So it's really awesome. You can do the whole bundle. This is going to save you the most money just to get the whole bundle. But if you want little short bundles, if you're like, hey, I've got $15 and that's what I've got right now, because I get it, nursing school is challenging and it's busy, then you can always just buy the course that you need by customizing your bundle. So I'm glad you guys joined us today. We're so glad to have you here with us. Again, thank you for being a part of the Archer Review community. We go live like this every Monday, Tuesday, Wednesday, and Friday. Tuesdays are nursing school and CCRN. Monday, Wednesday, Fridays are a little more focused NCLEX and nursing school. But we're so glad to have you all here. Tag your friends, let them know about us. We want to help each and every one of you reach your goal of becoming practicing nurses. Hope you all have a great weekend and a great day, and good luck to each and every one of you. Bye, everyone.